Harm reduction approaches cause us to ask questions about whether our values and beliefs are actually supportable in terms of behavior and data, and what are our real outcomes. We have to test our beliefs against our outcomes and our impact. Results, outcomes, and impact are very different ideas. We tend to look at big piles of numbers and think that we've just done a great thing because our numbers are very big, or they're getting small and reducing depending on what our question is. But they may have absolutely no meaning in terms of defining value for our outcomes or making change and, working toward desirable change. These are all very different kinds of metrics, and most of our public policy lacks any framing of outcomes or impact measures. And that's a real problem for public policy.
Let's talk about that with respect to, attorneys general in various states are rallying behind the framing and the narrative that the pharmaceutical industries pushed out drugs, those drugs addicted people. So suing them per the framing is going to be a useful, give us a useful outcome. And ostensibly, That outcome is geared toward helping the most vulnerable. Now, there are a lot of problems with that, but maybe we could you could help lay out why that can be a problematic assumption.
Well, it's framed on results, okay? The heft and the weight for that comes from like numbers of things like calls to poison control centers, number of visits to the emergency room that get billed and are paid for or not, the number of prescriptions that are written and pill units dispensed and doses delivered, okay? The problem with all of those measures is they don't inform our understanding of outcomes, and they don't inform our understanding of what difference we need to make when we are designing the questions that we ask about these results. So I go back to, the CMS indicators. We're ranking physician satisfaction and so forth. Okay, well, Joe Blow shows up at the ER and is in a crisis imposed by an overdose or a polypharmacy event. Joe Blow is treated and released, and the measure for that is that encounter with the emergency room. The data that is collected is the billing data that is used to bill Medicaid or Medicare or somebody, or to eat the cost if there's no payer source. So we're measuring the heft of that problem at the community level by the encounter with the ER. We are not using that data to follow up and determine whether that encounter had a positive or a negative impact on that person downstream in terms of outcomes. If we made referrals, did they get to the referral entity? Did that referral entity, were they able to exert a positive impact downstream that will keep that person out of the ER? Did that person go back to work, and did they continue to enjoy the benefit of employment without another catastrophic pharmaceutical event?
Yeah.
Okay.
So when we're talking about transferring funds from, winnings from litigation to a system of care, all anyone has to do is just say that that's what's happening, but we're not adequately measuring whether that's happening or not.
We're not adequately measuring, and because we don't have those measures, we're going to put that money and apply it into the things that we can see, touch, and measure, okay? We're going to put them into things like advertising programs. The same thing will happen to that money once the attorneys get done taking their cut, and once CMS exerts their control over some portion of those awards, and it will be significant, then whatever's left over will be applied to things that are very simple measures. Advertising campaigns, training of policing in the system, maybe the purchase of naloxone or Narcan units in the system, at the police level, at the drugstore level. Those are all things that are easily counted and observed, and we can see a very quick and simple measure from those things get distributed into the community. We don't know if they're effective. We have no idea, because that's not what we're measuring. So it won't take very long at all for all of those resources associated with those attorney general in Tennessee, which is my home state. Mm-hmm. The plan is to put any money that comes there into the general fund. It's not even, they don't even have a plan for it. Their goal is to pay themselves back for the cost of things like police calls, cost of training, and so forth. If that's the question you want to ask, that's the answer you're going to get.